Hello and welcome to Office Hours. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you want medically based answers to your weight questions, if you're confused about your weight, if you have questions about weight medicine, you are in the right place. Welcome. If you have questions afterwards, you can definitely leave them in the comments. I love hearing your questions. I love answering your questions. Please leave them in the comments or on a video. As a caveat, I can't answer personal medical questions. So because I'm not your personal doctor, if your question leans a little bit more personal, I'm going to change it a little bit so we make it more broadly educationally applicable. So with that being said, we are going to get started. The first two questions I'm going to address together because you'll see, it's kind of a variation on a theme. If a doctor's clinic is offering a tirzepatide compound and they say they are having it tested and that it's safe, will a person lose as much weight in comparison to them using an actual pharmacy, like FDA regulated pen? And that is a great question. I've made a video all about compounding, and if you've been watching these videos, you kind of know my stance around compounding. But the problem with compounded medication, and it's not that there isn't a time and a place for compounded medication, but the problem with kind of mass produced compounded medication is that you don't know if it's as effective, and you don't know if it's safe, and it's not regulated by the FDA. The whole system of regulations to help people get safe medicine is bypassed. So you really don't really know what you're getting, and you don't know if it's prepared like in a sterile environment. You have no idea. Like, hopefully it is, but you can't really be certain. The other problem is that you're not getting the exact same medicine. So you don't know if it's going to be exactly the same. You don't know if there is something else mixed into it. Eli Lilly is not, and they've said this, if you go online and read their press release, it's like they are not selling the material to make Zepbound, or they're not selling tirzepatide to compounding pharmacies to make additional versions of it. Like, they're not giving that. So what people are making is kind of an approximation, and it's not identical. So, is it going to be effective? I don't know. But the other thing is you just don't know if it's going to be as safe. This kind of leads into the next question, or the next comment that was shared. There are many of us who have no choice but to go on to compounded medication because we're not eligible through our insurance. Sometimes they don't even cover weight loss drugs, only telehealth and compounds. And that's the only way people can have access to this wonderful medication. And it's a really good point. I am extremely aware of the access issues for people. So even if people can find it in their pharmacy, they're very expensive, and sometimes insurance doesn't cover it, or they cover it partially, and it's still extremely expensive and very prohibitive for people, and they still can't afford it. However, I still don't think that going the compounded route is a great idea for what I just mentioned. But also, here's the other thing: if people are taking compounded medication, if they're going to a clinic, if they're going to a med spa, like, you're already paying out of pocket for that. It's not like that's I mean, the prices are going to vary, of course, but many times from what I hear, people are already paying hundreds of dollars for compounded medication. And to be paying hundreds of dollars and not being sure if you're getting something that's safe and effective just does not sound like a good idea. The other thing is that I think, as these medications become more and more available, I think things are going to be, ideally, we're going to have more and more options in terms of affordability. So, for example, Eli Lilly has just started selling vials of the 2.5 and the 5 milligram doses directly to patients through a prescription, of course. But like you would get a mail away pharmacy, they will now send the vials instead of the pre-made pens, and that can decrease the costs. Now, those are only available at the lower doses right now. But in the future, it would be great if that was also another option for people, because it does the price is essentially cut in half, if not more. So I think we're going to be seeing more and more of these types of ways to get it in a safer way, and maybe it's just coming in different vehicles. The other thing that I worry about with the compounded medication is that I worry that maybe the places where people are getting it from, and again, not everywhere, but just, there are some places that are going to be more incentivized by profit than your health. And I've definitely had patients who come to me and say, you know what, I just want to get the weight medication through you, because when I went to this place, they basically just asked which one I wanted. They didn't do like a medical history. They didn't ask me any questions. They felt really uncomfortable. They're like, no, this seems like it shouldn't, there should be a little bit more oversight. Or they're just communicating via text. They're not talking to an actual human. So I do worry that there is a lack of oversight for some of these places, and that they're more interested in just increasing sales and profit than actually helping people with their weight, making sure they don't have side effects, making sure that it's actually a good fit for them. So I worry about the responsibility of some of these places as well. And then certainly, there are risks with if people aren't having good oversight in terms of things like overdosing on medication. Like a lot of people, especially with the compounded medication, you're not getting it in an easy to use pen. So it's very easy to give it to yourself incorrectly. So these are all just other concerns, but I hear you loud and clear that the compounding route does seem to be like the only option for people. But I really caution you because, one, you're probably already spending a lot of money out of pocket anyway. Two, there are some sort of available, sort of affordable things like the Zepbound vials. Liraglutide just went generic as Victoza, so you could look into that. And then there's also the oral medications as well. And then, this is such a rapidly expanding field of medicine that there are new things coming out all the time. So in 2 years, we might think of, tirzepatide as like old news because we have all these other medications, and then it might be much more affordable for people then. So I can't see the future, but I just want people to just think about other options. Compounding is not the only option. Talk to your physician about, other things that might be available. If your physician isn't comfortable with it, you can definitely, go to the video I made about where to find an obesity medicine physician near you, because that is also a great resource for people. So I hope this clarifies for things, and for anybody who really wants to be on this medication and is having trouble, hopefully this is helpful for you. So thank you for those 2 great comments. That was extreme. I think a lot of people are going to be helped by that. Okay, so another question is, fatigue is an ongoing problem with the semaglutide. Okay, I'm going to shorten this one a little. Essentially, this person says, I know fatigue is a common effect, but in theory, is brain fog a common effect, or just sort of a decrease in concentration, or just feeling like just having brain fog? Does that come up for people? I will say clinically, I don't really hear about that. I have heard people say, people with ADHD who say, actually, this medication really helps my focus for whatever reason. It seems to be a helpful side effect for them. Not everybody, but some people notice that. And that might just be they're not as distracted about food. But I think we'll have a lot more. There's so much research that's being done about the ancillary benefits of these medications. And so it may be that for people with ADHD, there are other benefits to taking this as well, but stay tuned. But Anyway, I hear about fatigue. I don't hear about brain fog, but I do know that I have heard from others of you that that comes up a lot. And so, of course, when we have these medications, there's the kind of typical list of side effects that we see, but then there's always these, not everybody's the same, not everybody's body is going to react the same way. And I do know that there are some people that definitely do notice they have more of a brain fog. And whether that persists or not, I think is kind of going to be along the lines of how these side effects work for this class of medications in general, is that for some people it just really persists or gets worse as they go up on the dose. And then for some people, it just kind of, it's bad and then it kind of goes away or tapers off. So definitely if somebody is having brain fog, that's something they should go over with their physician. It's not something that I typically see, but I certainly wouldn't rule it out as, on the list of things that people could experience. In the same ways that, some people get insomnia. It's not something that I hear about a lot, but as millions of people are taking these medications, we're hearing more about these side effects that maybe didn't come up initially. So what a great question. Thank you so much for that. Okay, last question for the day is, in theory, have you heard a lot about people developing tinnitus or ringing in their ears when they're on this medication? And that's another one that I actually haven't. I don't think I've ever had a patient bring that up, but tinnitus can be caused by many, many different medications and can be kind of an insidious side effect that comes up with for people. And there's a very long list of medications that can cause tinnitus. So again, that's like that ringing in your ears. So, and then there's also other things that can cause it. So it's not necessarily tied to a medication, but so number one, I don't think I've ever had somebody complain about that to me. Number two, as with the last question, there certainly are, things that come up now that we have millions of people taking these medications that didn't come up when, in the test groups. So we're hearing more about like the more rare side effects. So I think it's definitely, again, well within the realm of possibility. And tinnitus is one of those side effects that can be caused by many different medications. But three, if somebody is having new onset tinnitus, you definitely want to check in with your physician because there are so many things that can cause it. There are medications that can cause it. Somebody could be on a different medication than the GLP-1 medication that could be causing it. Or it can be related to something else, something structural going on with your ears. So usually if I have a patient who has new onset tinnitus and we are not finding a cause, that's somebody that I will usually direct towards an ear, nose, and throat specialist to continue that workup. So if that's something that you are experiencing, definitely chat with your physician about it. But for me personally, in my clinic, I don't think I've ever had anybody mention that to me. But that is a great question. Thank you all so much for your questions. If you have questions afterwards, you can definitely leave them in the comment section below or on a particular video. If you want to work with me directly, I do work with people one-on-one as a life coach to help them with habit formation, those keystone habits that really help get them from where they're thinking of where they want to be to where they actually are. So if you're interested in working with me directly, I will leave that info down below. Thank you so much for watching. Thank you for your questions, and please be well.